I'm training to be a doctor, and one thing medical school doesn't prepare you for is how to identify signs and symptoms on darker skin. In 2020, I decided to take matters into my own hands and write a book called Mind the Gap, which featured pictures and descriptors about how different skin conditions presented on different skin tones. And all of this was because at medical school, it's almost as if people of color came onto the earth last week. In this video, I'm going to be giving you some tips on how you can identify different signs and symptoms on darker skin, and also telling you about the wider implications of medical school leaving out this part of their curricula. But first, let's get into a quick story. I got to medical school in 2018, and one thing that every single medical student does is as soon as you're taught about any condition, the minute that you get ill, you think that you have that condition. But for me, I would be in lectures and I would be looking at the lecture screens thinking, maybe I have that condition, but I'm not convinced I have that condition simply because it's not on my skin tone. And this kept on happening for months and months and months and months. And of course, when you see things over and over again, some of the things in medicine are just pattern recognition. You learn to recognize different patterns and different presentations. But I would go home and I'd be thinking to myself, well, I'm not entirely sure what I would do if that was on my skin tone. However, at the time I thought, surely this is a problem which is too simple. Like, to me, it was just common sense. I thought someone in the medical field had already figured this out. However, I figured out that nobody was actually thinking about this at all. So why is this a problem that nobody's thinking about it at all? Well, you have an entire community of people. In fact, the global majority of people in this world identify as people of color. And the medical system and the medical education that we are learning is almost universal around the world. And it's just not written in a language that allows for people of color to be even seen. Let's take something like redness, for example. If we talk about redness, redness is very subjective, and what redness looks like on my skin and what redness looks like on somebody else's skin is completely different. However, in medicine, we get taught about a lot of things such as signs of inflammation being redness, but we can see how the darker your skin tone, the harder that this will be to depict. And then you go into the issues of trust. A lot of black and brown people, especially in the UK and the US, don't trust the healthcare system. And one of the reasons being that if you knew that you were going to your healthcare professional and you didn't have full confidence that they know how to identify stuff on your skin tone, you would always second guess things. And it's so unfortunate that we're in this position. This also creates a world of implicit bias. And an implicit bias is something that people have just kind of got deeply ingrained into their system. One of those implicit biases being like black people's skin is thicker, black people don't feel as much pain, simply because when you were learning and you were learning to recognize those patterns, these patterns just never included those people that you're looking at. So this allows a lot of misconceptions and misbeliefs to stem up from a community who are not even included in these textbooks. Which is why medical education needs to do a better job at making sure that black and brown people are represented in the medical education. So let's get into some solutions. As I mentioned at the start of the video, I want to be able to give you some tips on how you can identify some basic signs in black and brown skin. And for more tips, check out Mind the Gap and blackandbrownskin.co.uk, where we have over 200 pictures of conditions on darker skin. The first one being pallor. I've already spoke about pallor in this video to say that pallor is essentially when somebody's going pale. And in medicine, this is a clinical sign for something called anemia. And anemia is just essentially when your blood doesn't have enough oxygen. And this is a warning sign for many different conditions, and it's also an early warning sign to say that oxygen is not moving freely around the blood. So the easiest way to detect pallor is usually from other family members or people who are around you, because they will be able to see that your skin tone is not looking the same as it usually is. In darker skin, what we also find when people go pale is that their skin tends to look more ashy. And ashiness is almost like a colloquial term that other black people use to describe their skin. So most people who are black will be able to tell you what ashiness looks like. For those of you that don't know what ashiness looks like, I'm going to put a few examples of what people would call ashiness. And thirdly, one of the ways to detect pallor is by looking inside of the mouth. If you see that the appearance inside of the mouth has gone pale, then this is another sign that the person may have anemia. I think in practical terms, sometimes just comparing against other people in the household or other people around you can be able to tell you whether this person is pale. Secondly, let's talk about cyanosis. Cyanosis is one of those things which you might have seen in everyday life. So if you've heard of anyone referring to things such as my lips going blue or my fingertips going blue, that's often a sign of cyanosis. And what this means clinically is that there is a lack of oxygen going around the body again. So your body almost diverts oxygen to the organs which are necessary. Which is why you see lips going blue, fingertips going blue, or sometimes these are the extremities which are just extremely cold. So of course, one of my biggest frustrations in medicine was when people would say, look out for the lips going blue, but...
What? Bro, what are you talking about, man?
Yeah, I don't think my lips would necessarily turn blue like that. When you're looking at cyanosis and darker skin, the thing that you want to look for is the deeper undertones of the lips. Usually this blue looks more like a purple, like a deep coloration and a deep discoloration of the lips. If you get someone to pull their eyelids down, you also might see that it's going almost like a grey or a white colour, and this again is a sign of poor oxygenation going around the body. Cyanosis is actually really topical because one of the ways to check somebody's oxygen saturations is by using a pulse oximeter. And we know that in the world of medicine that these pulse oximeters are not entirely accurate on darker skin. And this is because the pulse oximeter works essentially by sending light from one side to another side. And the darker your skin tone, the harder it is for that light to travel through, so it gives you inaccurate results. So when we're looking out for cyanosis, this is something that we have to essentially get better as a medical profession, because where we rely on oxygen saturation machines, even they too are not accurate, which again is another problem for black and brown people in the healthcare space. Thirdly, let's talk about jaundice. Jaundice is a condition where it essentially shows you that your liver or your gallbladder is not necessarily working properly. And what this results in is that your skin will appear yellow. And again, if I was to look jaundiced today, it would be really hard to detect whether I am actually yellow. However, on somebody with white skin, this is so clear. When you're looking at jaundice with people with darker skin, one of the things to look out for is the eyes. Amongst the whites of the eyes, you will expect to see a yellowing which is really apparent. And I'm going to also include some pictures about what jaundice looks like on darker skin. Another place to look is in the palmar surfaces. So sometimes it's very clear that the hands have changed colour very slightly and appearing more yellow to the rest of the body. And this is something that if you do see somebody with jaundice, you should probably call your doctor as soon as you can. In this video, I only spoke about 3 different clinical conditions and how they present on darker skin. If you want to see more pictures about how different conditions present on darker skin, head over to our website, which I'll link in the bio below, and you can find so many other pictures of conditions on darker skin. Again, this should be something that is common sense. In an ideal world, this video wouldn't even be out and you wouldn't be sitting this far into the video. However, it's something that we as a community need to get better at doing. The good thing is we are making progress in this space. There are so many other dermatologists and other clinicians and people out there who are very invested in this mission of making sure that black and brown people are represented in medical education. I think I get really optimistic and hopeful for the future that if we can continue to teach clinicians and just the members of the public about how conditions look like on darker skin, hopefully we can get to a point where we are not getting these misdiagnoses, these late diagnoses as a result of our clinicians simply not being trained. If you found this video useful, please share this video with somebody else who you think could do with this information. If you've made it this far into the video, I want to thank you and just say that you are now one step closer to being able to identify conditions on darker skin and also create a better world for all of our patients. The diversity in the world is only increasing, so this problem can only grow bigger if we don't do something about it. If you found this useful, share this video with a colleague, with a friend, or with somebody else, because I want as many people to be as part of our mission. And our mission is simple. We are creating a world where the quality of your healthcare is not compromised simply due to the colour of your skin.